morning. I am coming to you today to talk to you about environmental safety. So when we talk about safety, we're talking about one of our patients' basic human needs. Safety has been identified as an organizational priority in hospitals. It's been identified as an issue that needs to take priority. The American Nurse Association defines a culture of safety, which is what's being encouraged in all hospitals, a culture of safety as an organizational environment where core values and behaviors resulting from a collective and sustained commitment by the organizational leadership, manager, and workers emphasize safety over competing goals. So safety is a priority for our patients. So this should look familiar to you with Maslow's hierarchy of needs. And as you see, safety is right on the bottom, just above physiologic needs. Safety and security are included in the basic needs that our clients would need before being able to build up on that Maslow's hierarchy. So it is, as I said, going to be a priority for us to take care of our clients' needs and provide them with a safe environment. And you'll see as we talk about this more, when we say safe environment, we're not just talking in the hospital, we're also talking about at home. As I've said a million other times, we want to make sure that we're educating our clients to keep them safe, not just in the hospital, but also at home. We want them to be active in their care and prevent any illness or injury that could be prevented. So when we talk about safety, there's a lot of different things that could impact safety and that could affect what your client's going through and what's going to affect their safety. First up, developmental considerations. Obviously, safety is going to look different at different ages. So we're going to look more closely at the developmental differences and how we need to address safety concerns across the lifespan a little later. Next up is lifestyle. So that could be any number of things. So first up, that could be your occupation. If you work somewhere where there's excessive noise, then you're going to be at risk for hearing loss and injury. If you're working somewhere where there is smoke exposure, pollution, the other things thinking about that could put you at risk for on-the-job injuries, some factory work, operating heavy machinery, road construction, regular construction, linemen, our electrical linemen are at risk for work injuries, and nursing is at risk, and we're at risk for injury from mechanical work, from lifting patients. We're at risk for injuring our backs, knees, etc. Also, there's been an increase in workplace violence. So that's definitely something that's been on the rise that you've probably heard about in the news, is the workplace violence that can go on. Other things in lifestyle to consider: social behavior, choices people make, not wearing seat belts, not wearing helmets on motorcycles or ATVs, alcohol use, drug use, etc. When we look at environment, we're thinking about what's your environment? High crime neighborhoods and things like air and water pollution will impact your environment and the safety there. Mobility is going to be a big one. We'll talk a lot about falls in this when we get further in this presentation. But mobility, somebody with an unsteady gait, that's not steady on their feet, paralysis, a spinal cord injury, anybody that uses ambulatory aids for ambulation like walkers or canes while they facilitate movement, they also can put you at risk for injury and can increase your chance of fall. So education and careful instruction on proper use of those is necessary. Sensory perception is one. So People with vision problems are going to be at risk for falls and things. 30 to 60% of older adults greater than 65 years of age with vision impairment have experienced falls within the last year. That's the statistic there. So we know that vision impairment is going to increase your risk of falls. And when we talk about sensory perception, think about every sense. So that was vision. Smelling, our sense of smell protects us. If you can't smell, then you might not be able to smell a gas leak or smoke. In the event of a fire, you might not be able to smell if your milk or some sort of food has gone bad. Hearing, horns, sirens are not heard. And also, when we're talking about healthcare, if somebody's hard of hearing, they may not hear the instructions that we give them. And that's going to be particularly difficult right now with everybody wearing masks and not being able to read lips. Your sense of touch keeps you safe because it protects you from, if you laid your hand on a hot stove, you pull it back. If you don't have a sense of touch, you're at risk for more injury. And that would include like peripheral neuropathies and things where people have lost that sense of feeling. My grandfather had severe diabetes and had severe peripheral neuropathy, and he couldn't feel anything with his feet. And so he wore shoes all the time on the beach, anything. He always had on shoes with hard soles because if he stepped on a piece of glass on the beach, he wouldn't know it. And so he would bleed, that cut would get infected, and that could lead to really bad injuries, especially as you learn more about disease processes with diabetics. They're with that peripheral neuropathy, and they're not going to heal appropriately in that foot. So that sense of touch is a big one to keep us safe. Knowledge deficits, things like an example of this would be if your client uses oxygen therapy at home, if they don't know not to smoke around their oxygen tank, if they're still smoking, they can't smoke with that oxygen tank on because it could ignite that oxygen. So education is going to be really important, educating our clients to prevent safety problems. Ability to communicate. People who have had strokes, have language barriers, have a hard time, and other things that may interfere with somebody's ability to communicate can impair and alter and really affect their safety. I one time was doing a stress test on a patient. When I was working in the cardiovascular lab, I was doing a stress test on a gentleman who was non-English speaking. And I got the interpreter phone out to go over his health history, talk to him about what's brought him in and what his signs and symptoms were. So he was going over his home medicines with me, and he had a bottle of nitroglycerin. Nitroglycerin is something that's given for chest pain, for angina, but it's a strong vasodilator. It drops your blood pressure. And one of the side effects is headache, a severe, bad headache. And so he's going over these medications with me, and he tells me that he came in for a stress test because he was having dizzy spells. Okay. He tells me that he was taking his nitroglycerin for headaches. And what was actually happening was he was constantly taking this nitroglycerin 3 times a day for headaches that were caused by the nitroglycerin. That nitroglycerin was causing his blood pressure to drop and causing him to have these dizzy spells. But what happened was he didn't have a proper interpreter. When he got the medication, the instructions were in English on his bottle. He couldn't read English. And when he didn't have a proper interpreter, and when they told him that it could cause a headache, he thought they said that he should take it for a headache. This could have, we got it figured out. We got him straightened out, and his stress test came back normal. But this could have been a major major incident for him. Could have been very dangerous. So that is a big safety factor, is having that ability to communicate. Physical health state, things like illness, a lot of things with cardiovascular disease, as I just talked about with the blood pressure drop, can cause dizziness, can lead to falls. So there's a lot of different physical things that can lead to falls. And then psychosocial, things like stress and depression can affect somebody's safety. So when we talk about safety assessments, we are talking about holistic care of our client. So we're not talking about just when they're in the hospital. We want to look at as a whole, them, their environment, and then we'll talk about some specific risk assessments that we also want to look at. So when we look at the person and doing a safety assessment on the person, this is going to be a nursing assessment as far as your client's history and physical. So things that we want to know about to assess safety for our client is, have they had a history of falls? Do they use any assistive devices like canes or walkers? As I said, that can lead to increased chance of falls. Do they have a history of drug or alcohol abuse? Do they have a support system at home? Do they have people that at home with them, or are they home by themselves? A mobility status. Are they able to walk around with ease? Is there difficulty climbing stairs? Are they able to communicate their needs? Do they have any sensory deficits? We also want to assess their level of awareness and orientation, and are they receptive to their limitations, or do they think they can do more than what they can? My sweet little grandmother, before she did have to go to stay somewhere with full-time care, we had to end up locking her out of her laundry room and putting a lock in where she couldn't go in there, because she kept falling off the washing machine. Now, why was she climbing on the washing machine? Nobody really knows. But what I know is that was not a realistic grasp of what her abilities were at the age of 80. To be climbing up on the washing machine for, nobody even knows why. So, assess level of awareness, orientation, and their ability to know their limitations. Assess for sensory perception. Do they have any altered sensory perceptions that are going to put them at more risk? And then also think about recognizing manifestations of domestic violence, abuse, or neglect. I'm not going to get really deep into this because you will get this content, I believe, in 212 whenever you are in your last semester, but do have that in mind. There's unfortunately a lot of sad situations out there, so be ready to advocate for your clients. So in assessing the environment, we need to give it the same amount of attention as we do assessing the person, because environment matters. So what's going on in the home or the community or with a healthcare agency can lead to injuries. So we want to be diligent in our assessment of the environment. We want to make sure we're looking out for people who may be at risk, identifying clients who are at risk for injury, and then recognizing unsafe situations that they may be in. And then, we'll talk more about some specific things with the environment coming up. Next up, it's going to be on the next slide. We're going to talk about these specific risk factor assessments. And these are going to be falls, poisoning, fires, suffocation, choking, and firearm injuries. So with falls, we are going to talk about more because Obviously, in the healthcare setting, that's going to be a major concern of ours, is going to be preventing falls in the hospital. So we'll talk about that some more after we get through some of this other stuff and talk about other age-related, age-specific risk. But with falls, 1 out of 4 adults that's greater than 65 will falls each year. And less than half of them are going to tell their healthcare provider that they did fall. 1 out of 5 of those falls is going to result in serious injury. 95% of hip fractures from falls result from falls. Last year, there were 800,000 admissions to hospitals for older adults due to falls. So a falls assessment during the nursing history and a physical assessment is going to be necessary. So as I said, we will talk more about that in just a little bit. We use the Morse fall scale, and I'll show you that, and talk about some fall prevention protocols. Next up is fires. So 80% of fire-related deaths occur in the home, and most of them happen at night when people are asleep. So at the house, we want to do fire assessments. We want to assess the family's knowledge of fire hazards and educate them on decreasing risk factors like smoking in bed, having lit candles. If people use electrical heaters, making sure that they're clear of any flammable objects. We want to educate to make sure that fire alarms are present on every floor and in sleeping areas, and that there is that they're being tested. It's suggested that they're tested once a month. So we also want to know how the house is heated. Is it a wood stove or a kerosene heater? Or is it central heat? Because that can impact the risk for fires in the house. So that's some of the things that we'll want to look at home. When we look at fire safety in the facility, priority for us is going to be to protect our patients. We don't want our patients to be injured in a fire that occurred on our watch. So nurses, be prepared to protect the patients. One thing that we need to do is inspect the equipment. We need to avoid any frayed cords. If you see a frayed cord, that medical device, whatever it is, needs to be unplugged and sent to the repair department that will deal with those. Watch out for things overheating, like pumps and things, and having blankets over top of them. We want to know where fire extinguishers are and how to use them. And the acronym for using a fire extinguisher is PASS. If you are not familiar with it, it stands for pull, aim, squeeze, sweep. So pull the pin out of the fire extinguisher, squeeze the handle, aim at the fire, squeeze the handle, and then sweep back and forth towards the base. If you've never used a fire extinguisher before, it's actually harder to put the fire out than what you think. I mean, you really need to aim at the base of the fire. Secondly, in the hospital, we use the acronym RACE for protecting our clients in the event of a fire. RACE stands for rescue, alarm or activate, confine, and evacuate. So that is the order in which you need to intervene in the case of a fire. If you smell or see smoke, first thing you would do is rescue anyone in immediate danger. If there is a person in that room or anywhere close to it, you need to remove anyone that could be in danger away from the fire. Next thing is to activate the fire code system and notify the appropriate personnel. And the C is for confine, so close the door and windows wherever the fire is. All the hospitals have multiple locking doors that are fire doors, so you want to get all those fire doors closed. And lastly, you want to evacuate everybody to a safe area. So poisoning, there's a lot of sources for poisoning. So one of the big ones we talk about is medication safety, unsafe storage of medicines, vitamins, and cleaning supplies. Where are they stored? They need to be stored in childproof cabinets and preferably locked where children can't get to them. And the medications need to have childproof lids on them. This is a major risk. For that matter, don't ever with children, if you're giving them medication and you're trying to get them to take things, never, never, never call it candy. Because if you do, just take your candy. That's going to be confusing for children, and they may then see grandma's heart pills and think it's candy and take those. And some of those heart medications have really long half-lives. We've talked about in pharmacology. It's going to be really hard to get those excreted from the children's system and can have detrimental effect there. So be very careful and educate your clients about medication storage, especially when there's small children at home. Carbon monoxide poisoning. Carbon monoxide is colorless and odorless. It can happen with malfunctioning gas logs or heats or stoves. You need to have, it is suggested that there are carbon monoxide detectors in the homes, same as with the smoke detectors. You can get combo detectors that are both carbon monoxide and smoke. Poison control center phone numbers need to be available at home. And then also with the poisoning and medications, not just children are at risk for toxicity from medications, but also elderly patients who may be confused, maybe have even mild dementia or memory loss, take their morning medications, don't remember that they took them, may take them again, end up having a toxic medication event. And so educating elderly clients, making sure they have support systems present and proper medication management. Suffocation and choking is a greater incidence with children. So some of the causes here is going to be drowning that we may see, choking on a foreign substance, small toys or coins, climbing inside of appliances is something that is seen, getting into the refrigerator or a freezer, washer, dryer, and can't get out can lead to suffocation. So educating families on preventing these things, it is going to be very important. We'll talk more about that in age-related risk factors. And lastly, firearms in the home. Firearm accidents can happen anywhere to anybody of any age. So education on proper storage and of firearms in the home and firearm safety is going to be important. Especially think about school-age children who start spending the night at people's houses. If they don't have any kind of firearms or anything at home, and going to other children's houses, making sure you educate your children about the risk of firearms and that they're not toys and how to react if somebody brings out a gun at somebody else's house they're at. So what are the outcomes we want for our clients? Safety is going to be all about preventing things. It's going to be all about prevention and making sure things don't happen. So here are some of the outcomes that we want for our clients. We want them to be able to identify real and potential unsafe environmental situations, implement safety measures to keep injury from happening, use available resources for information, incorporate accident prevention into their regular activities of daily life, and ultimately to remain free of injury. So one of the things we'll talk about is we're getting ready to talk about age-specific safety considerations. So thinking about health teaching in schools, which looks a lot different right now than what it did last year, right? So disease prevention, hand hygiene, obviously children are socially distanced and wearing masks right now. Teaching children how to do CPR. They can learn how to do hands-only CPR. We need to be monitoring children's use of the internet. That is cyber safety is going to be a big push moving forward. And we just want to encourage parents to be involved in the school activities as parents, and volunteer to be active parts of their children's education and preventing injury or illness. All right, so let's look at age-specific safety considerations. There is a table in your book. It's the teaching tips table 27-1 in your fundamentals book that has an excellent information for educating your clients for age-specific safety issues. So first up, we have a neonate, so newborn babies. So with these, it's about preventing mostly accidents from happening. So avoiding leaving the baby unattended, making sure that there's crib rails up, monitoring for choking hazards, keeping and teaching parents about safe sleep. So putting the baby on their back and to sleep without any blankets or toys or pillows in the bed, and no crib bumpers. And making sure, one of the big ones too, is making sure that parents know how to use car seats properly. Next up, we have toddlers and preschool age children. These children, if you have children that have gone through this stage, you know they touch everything. They put their hands on everything. They put everything in their mouths. Some kids more than others. I know my son put everything in his mouth. He's very tactile. He still is, but he's 8 now, so he doesn't stick everything in his mouth, luckily, but he has to touch everything. And when he was a toddler, preschooler even, he was still just put everything in his mouth. My daughter never really put anything in her mouth, but she had her own issues. So child-proofing the house to make a safe environment, preventing poisoning, so making sure that that any medications are locked and away safe where they cannot get to them. Same with any household cleaners. We need to be alert to any manifestations of potential abuse or maltreatment or neglect with these children, and then still educating on proper car seat usage as children progress in age and have different booster seats with and without the back, and when can they come out of, when can they start facing forward, making sure that they are being educated appropriately on car seat usage. For school-age children, we want to just help them to avoid activities that can be dangerous. This is where my kids are right now. My son does a lot of things that I'm like, why would you do that? Why would you think that that was a good idea and that you wouldn't end up with a brain injury? So helping them learn to make good decisions, providing interventions for safety at home and at school and the neighborhood. We're going to start, at this time, we'll start talking about cyber safety. Children are online more than ever, and they are exposed to more than ever. So making sure they understand cyber safety, not accepting messages from strangers, especially with some of these there's so many video games and things that are interactive with other players. talk about bicycle safety and safety with other ATVs and things, making sure they're wearing helmets and proper safety gear whenever they're on their skateboards, bicycles, etc. We want to educate them about the risk of child abduction. And so I had that conversation with my kids. It's not a fun conversation to have because you don't want to scare them, but they do need to be aware and know what to do in emergencies. These age groups should know their home address, their parents' phone numbers. They need to know what to do in events of emergencies. And this goes for the whole house. You should have an emergency plan for different things like intruders. If there's a fire in the house, you need to have escape plans ready, and for children to understand what to do in these situations. Also educating them about wearing seat belts. So then when we get to the adolescent age, which I haven't had the pleasure of going through with my own children, we want to start talking about safe driving. Motor vehicle accidents are a huge cause of death with teenagers. So safe driving, minimizing distractions while they're driving is going to be very important. Teaching to avoid alcohol and tobacco and the risk involved with those. Same with risk of infection with body piercings and tattoos. It's hard for teenagers to understand that there is things that matter after the 5 minutes that they're living in. So trying to teach them about consequences to actions, both with school-age children and adolescents, teaching about the dangers of bullying and social pressures, and again, just education and prevention is going to be key. Talking about the dangers associated with the internet are going to increase at this age because they're going to have more freedom. They may not have as much monitoring going on from their parents and have more access to more apps and things that can lead to danger. And also needing to talk about guns and violence. As I said, you know, I have the conversation with school-age children, but still with teenagers too, because going to parties, people bringing things to parties, making sure that they know what to do, how to react in the event that guns or violence are present in their environment. For adults, we need to talk to them about the effects of stress on their lifestyle and health. So remember, we just talked about sleep and rest. So making sure that they're being educated about the need for sleep and rest and a work-life balance, and good, healthy, having a good, healthy balance. Also need to talk about unhealthy habits like alcohol and drug abuse, and about domestic violence, being on the lookout for domestic violence, and educating on what can be done if they are at risk for that. As I said, you'll get more about that in 212, so I'm not going to go too deep into it. For older adults, it's going to be a lot about preventing accidents, making sure that they're oriented to their surroundings. We're going to talk more about falls in a little bit, so I'll get back to that. Maintain a vehicle in working order and with scheduled eye exams to make sure that they are able to see appropriately. Loss of independence is hard. But that said, making sure that older adults are still safe to drive is going to be very important. We want to go through all those things we talked about earlier to make sure their homes are safe, that they have the assistance and support that they need, using medication trays to prevent toxicity, and then recognizing the signs of elder abuse. If you suspect elder abuse, one of the first things you can do is try to talk to the client alone without their caregiver present, about if there is some neglect or abuse going on at home. As I said, unfortunately, it is a realistic thing that we will encounter as nurses. So let's talk more about falls. So this chart is from your book, and so we have some modifiable, potentially modifiable issues that can affect, increase somebody's chances of falls. Weakness, poor vision, gait or balance issues, problems with their feet or their shoes, use of psychoactive medications that can lead to dizziness, postural dizziness, so that could be changes in blood pressure when you're changing position. Sometimes that has to do with medications, and then hazards in the home. So you can look over this chart to kind of familiarize with things that put a lot of our elderly population at risk: this advanced age, falling, previous falls, weakness, poor vision, chronic conditions, and then also environmental issues like not having rails, not having a good stair design, bathroom grab bars is a big one. Bathroom safety is going to be a big one, especially with our elderly. We want to make sure that they are, that they have non-skid surfaces in their bathroom, that they have adequate lighting, and that they have bars, those bars up in the bathtub to hold on to support their weight, and also possibly around the toilet, elevated toilet seats. We want to make sure they have handrails throughout the house, especially with stairs, and common walking areas. Lighting wise, dim lighting can increase chances of falls, so we want to make sure that they have all of the, have night lights up and proper lighting where they're going to be walking. So preventing, as we're talking about, when I had popped over to this slide because I was talking about preventing falls at home, so I thought I'd pop on over to this area. So major causes of falls at home are going to include slippery surfaces, poor lighting, clutter, a lot of stuff everywhere, loose throw rugs. I trip over loose throw rugs all the time. In my own house, improper fitting clothing like pants that are sagging, that are getting them caught up, or slippers. Common traffic areas in the home need to be cleared and have nice firm surfaces, not those slippery throw rugs. Handrails in the bathrooms and on stairs, good lighting everywhere. There shouldn't be any broken equipment or too much clutter about that is going to lead to falls. Shoes should be rubber soled, solid, well, good fitting shoes that aren't flopping around on their feet and sliding around. So preventing falls in the healthcare facility. Let's talk about that. We've got a picture of our Morse fall scale. As I mentioned earlier, falls are a common cause of hospital admissions for trauma. The Joint Commission and the Centers for Medicare and Medicaid Services, CMS, have identified falls as a never event. And you'll learn more about never events later in the semester, I believe. But falls are a never event. They are considered preventable and should never happen in a healthcare facility. So here's some things that we do as nurses to help to prevent falls in the healthcare facility. So these are going to be important. We complete a risk assessment. For you guys, we use this Morse fall scale. We have some way of indicating if somebody is at high risk for a fall, whether that's on the patient, in the patient's room, it's in their chart. That's going to be facility specific. Some facilities have armbands that patients wear that identify them as high risk for falls. We want to keep beds in low position at all times. I do not want to walk into your room and find that bed 5 feet up in the air because you were doing your assessment on your patient. You forgot to put it down. Very dangerous. So beds need to be in low position. The wheels on the bed should be locked. If a patient's in a wheelchair, those wheels should be locked. A lot of the beds in hospitals now will beep and make loud noises if they are unlocked. We want to make the patient, we want to make it so that our patients aren't trying to climb out of bed or trying to reach for something that they can't get to. So we want to make sure that their call bell is in close reach to them, that they're always able to reach the call bell. That should be something you do every single time you leave the room, is your call bell close by. Instruct them how to use the call bell, and then answer the call bell promptly. If a client calls out to go to the bathroom and they need to go to the bathroom, then nobody answers that call bell for 10 minutes. They might get up and fall in the process trying to get up to the bathroom. We want to have a night light on if applicable, to so that it is easy to see if a patient is up without assistance, so that they can see at night, especially in an unfamiliar environment. We want to eliminate all physical hazards that we can in the room. So your clients are going to be attached to IVs, maybe heart monitors, maybe they've got SCDs on their legs, there's cords in the room, there's a bedside table, there's stuff everywhere, and they're in an unfamiliar environment, and they may not be able to manage all those wires and things going to the bathroom and things. So even if your patient's good on their feet, you may still want to say, hey, I still need you to call out because of these risks with these things and getting tangled up. I just want to make sure we don't pull your IV out or that you get tripped up on something. I'll give you privacy after you get to the bathroom, but I'd really like to help you to get there just to stay safe. We want to make sure that clients are wearing non-skid footwear. Hospitals do have non-slide socks that we can put on our patients to keep them from sliding around. Just like the call bell, we want to make sure that they can reach anything that they might need. Like if they're able to drink, we want them to have their water close by, tissues, the urinal, anything that they might need like that within their reach. We need to make sure we're regularly assessing the client's cognitive status and reporting any changes that may increase the risk of falls. So if you have any questions, please feel free to reach out. Let me know if there's anything I can clarify for you. You can put a comment or question into the forum, or you can send me an email as well. Thank you guys. Have a great rest of your day.